What do you guys got there, 2 o'clock or what?
Oh, keep going.
Good afternoon, everyone. Welcome to our COVID-19 update for Tuesday, March 30th. And as usual, we will be joined by Dr. Gail Burstein. Of course, Kendra Schmidt from Deaf Access Services is here to provide the American Sign Language, and we have a special guest, Dr. Nylander, who will be also joining Dr. Burstein to talk about COVID-19 issues and why it is so important to get vaccinated. Let's jump right into it. As of March 28th, there were 72,717 confirmed unique cases of COVID-19 in Erie County. The number keeps on going up. In fact, there were 2,645 new cases during the last week. That is an increase. It is increasing also as a percentage per 100,000 residents. So it would be the equivalent of 288 new cases per 100,000 residents for Erie County in the last 7 days. It's going in the wrong direction. And the other thing that's gone up in the last week are hospitalizations for both Western New York and Erie County. On March 28th, there were 190 COVID-19 patients in Western New York hospitals, 45 in the ICU, and there were 176 patients in Erie County hospitals, 39 in the ICU, 19 were on an airway assist, and 3 died in the Erie County hospitals on March 28th. You can see from the chart that we have seen a significant increase in the last week to 10 days in hospitalizations. It had been dropping and then it stayed fairly stable for 2 to 3 weeks. And unfortunately in the last week to a little less than 10 days, we've seen a steady increase in the number of new hospitalizations as well as ICU patients. We have received confirmation from one hospital system, Catholic Health System, that it has seen a marked increase in COVID-19 patients, and the individuals that are coming to the hospital are coming with symptoms of COVID-19. They may already know they're positive with COVID-19, or they don't find out they're positive with COVID-19 until they get to the hospital, but they're coming in with symptoms of COVID-19. They are not coming for an elective surgery. They're not coming for some other matter where it's determined that they're asymptomatic with COVID-19 while they're in the hospital. So people are getting sick, and more people are getting sick to the point where they need to be hospitalized for COVID-19. As noted in the chart here, while we still have 67% of Erie County beds occupied, that is total beds, it is not just with COVID patients, we have seen hospitalizations increase for COVID-19 patients by roughly a third in just the last week, and 44% of COVID-19 hospitalizations are individuals under the age of 65. As we will show you, for new cases, it's not the 80 and above category that are catching new cases. Most of those individuals have been vaccinated. It is younger individuals, and that's why we're seeing an increase in the percentage of individuals who are catching COVID-19 and being hospitalized that are 65 and under. So, looking at the confirmed cases for the past 6 weeks, and for the week ending, these are not as exactly the same that you saw in the chart before, because that was for the date ending of March 27th or 28th, but this is for March 27th. For the week ending, we did see a significant increase, roughly a 25% increase in new COVID-19 cases from the week of March 20th to March 27th. Our rate per 100,000 population over a 7-day period has increased. It's actually increased by an average of 100 cases just since the beginning of the month of March. And the increase in the last 2 to 3 weeks does let us know that there is greater prevalence of COVID-19 in our community than we truthfully would want. So we're asking for everyone to continue to be smart about this. If your time has come to get vaccinated and you can be vaccinated, try to get an appointment. We'll talk a lot more about vaccination appointments coming up. If you have an opportunity and you have been vaccinated, please wear a mask when you're out in public, because you still have an opportunity to catch it and pass it on to others, even if you yourself will not get sick from it. And it's just pretty sad to see these numbers going up. It is the same thing that they're seeing in New York State and the same thing that is happening nationwide, and all we have to do is look worldwide to see the numbers going up, especially in Europe, and hopefully we never have anything like what they're having in Brazil. So I just want to remind everyone that if I had my choice, we wouldn't have to do this press conference at 2 o'clock on a Tuesday anymore because we'd be done with this, but we're not done with it. And as a result, we need to continue to act appropriately to protect ourselves and our loved ones and our fellow brothers and sisters in the community. Looking at the rates by zip code, you will see that they are much higher than we'd like. Based on the raw data, the zip code with the highest number of new cases was the town of West Seneca's 14224, which had 151 new cases and had a very high rate of 378.6% of new cases per 100,000 population over a 7-day period. Remember, the CDC treats 100 cases or more per week over 100,000 population as a high risk of transmission of COVID-19. We've been talking about this for some time, and unfortunately the numbers are going up. We are seeing some really high numbers in various areas, including in the town of Hamburg, Lakeview. If you note, it's near the bottom of the chart, 14085. It only had 39 new cases, but as a percentage of new cases per 100,000 people in on a 7-day average, it's over 500. My hometown of Lackawanna is nearly 400. And there are others that are, of course, in the 300. So we are not happy to see the number going up. We stopped doing the weekly positivity rate as determined by Erie County, and we're just relying on the state rate because they weren't providing us the pool testing. But the weekly positivity rate, the daily positivity rate as provided by New York State is going up too. So please, please act accordingly. Because what often happens is people catch COVID, they get sick, they go into the hospital, and then they die. And unfortunately, since March 1st, 2020, through March 25th of this year, 1,726 Erie County residents have died from COVID-19 complications. 1,274 in 2020, 452 of them in 2021. And you will note we are seeing, as a percentage of the deaths, the average death age drop as we've moved along this year. It was 81 in January, 76 in February, 75 in March. You will see individuals in the 80, 70, 60s, 50s, and 40s who've died from COVID-19, not only this year, but this month. And we often talk about it as a number, and I've talked about this not being number. These are grandparents, sons and daughters, brothers and sisters, parents. And I was lucky up until this past week. I've known people who've lost loved ones who died from COVID-19, but I didn't have a close personal friend or family member who died from COVID-19 until this past week, when a very good friend of mine, Robert Bob Farmer, passed away from COVID complications. And he was also a county employee who was a very valued member of the Medicaid Inspector General's office. I attended Bob's funeral earlier today. Bob actually, and this is public knowledge, was vaccinated, but he had suffered some serious health issues in the last years, and there was always a question as to whether or not his immune system would be able to generate enough antibodies to protect him if he should happen to have caught COVID-19. And Bob passed away, unfortunately, last Tuesday. After I performed my press conference, I found out about his passing. He was a good man. He was loved by all. He was one of those guys who'd give you the shirt off his back, even if it was the last one. As was noted in the funeral today, he jumped through fire for the people that he loved, his family and his friends. We already miss him, but I want to remind everyone that's out there, these aren't statistics, just numbers. These are people. These are individuals who made a difference in our community. And when we talk about the deaths in our community, we're talking about nearly 1,800 Erie County residents who are like Bob Farmer, who had friends and loved ones who will mourn their passing. So to each and everyone out there, we are not out of COVID yet. We have so much more that we still need to do to vaccinate the general public until we can get to herd immunity, and we need to act appropriately. Bobby was a good friend. May his soul rest in peace. And just know that I hope others don't have to go through the loss that many others have had, and Bob's family and friends have had to, any more than we've had, because COVID has been a nightmare. And to each and all those who've lost a loved one, you have my deepest condolences on what truly has been a very sad part of our lifetimes in history. With that, I want to turn it over to Dr. Burstein to talk about some of the issues, including increased cases that we are seeing in schools.
Thank you. So as the county executive mentioned, we are seeing many more cases in schools right now, and even higher numbers than what we saw in the winter. So this past week, ending on March 27th, we had 306 cases reported to us from that were people who were either students or staff, but almost all students involved with the schools from pre-K to grade 12. So this is, again, the highest number of reports that we've had from the schools. And even just this week has been even worse. Just today, when the last time I spoke with our EPI team that works with the schools at 1 o'clock, so as of 1 o'clock today, there are already 88 cases that are either students or staff in the schools that were already reported with COVID-19, just at 1 o'clock today. And so far this week, as of starting on Sunday, there's already been 196 cases, and the week isn't even over yet. So we are seeing so many cases in the schools. And again, it's different. These are mostly students, not so much staff. At the beginning of the pandemic, we saw more staff transmission. Right now, we're seeing a lot more cases in the schools. And unfortunately, some schools are deciding to close their buildings and pivot to online learning for 10 days because of all the disease in the schools. So this is something that's really, really serious. So just to highlight the number of cases that we're seeing in the younger age groups as opposed to what we've seen in the past, these are data looking at confirmed COVID-19 cases by age group. And so we're looking at the proportion of positive tests, not including the surveillance testing that is being done by SUNY, but these are the tests that we receive both the positive and the negative results in Erie County. So you can see that through the 11 and 13-year-olds and the 14 to 17-year-olds, we've seen a successively increasing proportion of positive tests over the past 4 weeks. So at this last week, ending on this past Saturday, March 27th, about 11 to 12% of all the tests among the teenagers in Erie County were positive. So that is a very high number. That's a higher number than we've ever seen before in this age group. So now we're looking at our rates of confirmed cases of COVID-19 for this past week ending March 27th. So because we don't get the surveillance testing from the SUNY schools, as the county executive mentioned, we're looking at rates per 100,000 population for the past 7 days. And so I just want to point out that in all age groups, the numbers are significant. And the highest numbers are in people in their 20s and 30s. And that's the age group where vaccinations are opening up this week and next week. So it's really important that people in their 20s and 30s, because we know that there's a lot of transmission in this age group, get vaccinated as soon as you can, because that's going to be a key strategy to bringing down the numbers in our community, is by getting people where we're seeing the most transmission protected against infection for COVID-19. So I'm going to talk about how Erie County is responding to our COVID-19 pandemic. So right now, I have the pleasure of presenting a special guest star to our weekly press conference, Dr. Emra Nylander. She is an obstetrician gynecologist who works in Buffalo OBGYN in Amherst, New York. She is a very active member in the American College of Obstetrics and Gynecology. She's also very active in many of our local professional medical organization, and she's also done some great work on medical missions over the past few years. So we invited Dr. Nylander to join us today so you can hear from her own words, from one of our esteemed physicians in our community, why it's so important to think about getting a COVID-19 vaccine for you personally. So we're very fortunate enough to have Dr. Nylander today, and I'm going to turn it over to her to talk about COVID-19 vaccination.
Good afternoon, and thank you, Mr. Polenkars and Dr. Burstein, for inviting me here today. I also want to say Happy Doctor's Day to my colleagues out there. As an OBGYN, my patients come from diverse backgrounds and life experiences, and I can honestly say that every patient and every pregnancy is unique. During this very difficult year, COVID-19 has become a common thread and an impact on all my patients, and in many cases, their pregnancies. I've seen moms where they didn't even know before going into the hospital that they had COVID-19, and the fear in their face about caring for a child when they have COVID-19, and trying to ease their fears and make them feel safe in the hospital and in the environment that we were in. Office visits, when they come to the office, we have set up our office so that we are limiting people in the office. We're not allowing everybody to bring their mom and their husband or their siblings to the visits. We're doing the best that we can in our environment to preserve and protect our patients. Things that we are doing as far as notifying patients beforehand and getting them to call the office if they have any symptoms, and we can alert them if we're concerned that they may need to get checked for COVID-19. It's hard because babies are being born and they're not being able to be shared with family members. So grandparents can't come to the house and see the newborn, and they're only meeting them over Zoom. We know this is a difficult time for moms and parents and babies and grandparents. We have to talk to them about their fears and their uncertainties and provide them that safety net that they know things are going to be okay. With the vaccine, that's helped. We're able to show them that by getting vaccinated, you can have an opportunity to share the joy of having a newborn with your sister or their uncle or their grandparent if they've been vaccinated. So a lot of my patients ask me, well, Dr. Nylander, why did you get vaccinated? And I got vaccinated because it was offered to me in December, literally 3 days before Christmas. And I thought that was the biggest Christmas gift I could receive. I was able to go and get vaccinated, and I was fully vaccinated in January. And when I see people out and I ask them if they've been vaccinated and they tell me no, and they tell me they're afraid, I ask them why. And they tell me, well, doctor, I don't know if it's that safe. I don't know, I can't trust it. And I tell them, look, I've been fully vaccinated since January, 4 months almost, and I'm safe, and I'm healthy, and I'm well, and I can take care of my patients, and I can take care of my 84-year-old grandmother, or my mother, sorry, not grandmother, mother. And it gives me a sense of security that I have my 11-year-old daughter who goes to a private school, that she's protected because I'm protected. Healthcare workers were amongst the first to be vaccinated because as frontline workers who tend to people who are ill or vulnerable, my choice was to get vaccinated. It was my responsibility. We all know that the principle of medicine is to protect and preserve the health of patients. My vaccine protects me and those around me like my pregnant patients, like my older patients, all of whom are considered to be at higher risk for COVID-19 complications. Now that vaccines are on the scene, my vaccine also protects my patients' children and their households. It also protects, again, those closest to me, my family and my colleagues. They are a big part of my life, and I want them to stay healthy. So I did get my 84-year-old mother vaccinated, and it was a big relief for me. And I urge you, those of you who are on the fence about getting the COVID-19 vaccine, that it's okay. It's okay to have those fears. I had them as well. There are millions of people out there with exactly that perspective. This is a COVID-19 pandemic, and we're all still learning, and even the doctors. And we're not experts, we're just learning as we continue to go. I challenge those of you who are asking if this vaccine is right for me to start asking questions. Educate yourself. Come to people like your health provider. Ask your medical professional what their thoughts are on the vaccine. And then the Erie County Health Department and community partners with whom they are working, and medical professionals like myself, we're all going to be here for you to answer those questions. So another question that's been very recently asked is whether pregnant moms or breastfeeding moms should get COVID-19 vaccine. Absolutely. The risks for COVID-19 getting COVID-19 are much higher than the risks from getting the vaccine. If you have questions, talk it through with your OBGYN provider. Ask them, talk through your concerns, and we can tell you what the benefits are. We're seeing, there was a recent report that showed that the antibodies going to the baby are actually increased in those getting the vaccine, more so than those who've actually had COVID-19. So there is a benefit. The sense of relief is what I share with my patients when they ask me about my vaccination. As I told you, I got it right before Christmas, and that was the best Christmas gift ever. It's also a marker for me for when we went to playing defense against the disease and getting this pandemic under control. We need to put this behind us. So I urge the community and people who look like me in the community to consider getting your vaccine and getting vaccinated to protect you and your family.
Thank you. Well, thank you, Dr. Nylander. Those were really great words. So I hope they inspired some of our viewers out there. So I'm going to be talking more about vaccine. I'm going to talk about what's going on with vaccinations in Erie County. So some good news. So with the Erie County Health Department, we are continue to actively vaccinate. We have regular clinics at SUNY Erie Community College North and SUNY Erie Community College South campuses and the KeyBank Center in downtown Buffalo. We're also hosting one-day pop-up clinics throughout the community. So we'll be announcing those later on, and we're really trying to get into the community, making it convenient for every single person who wants to get vaccinated to get that vaccine. All the vaccines are by appointment only. And next week, we're really excited. We're going to be announcing our new online and phone appointment system that is going to be opened up later on in April. So just looking at how much vaccine we're getting. So the Erie County Health Department, we are receiving a lot of vaccine this week. We're so excited. We're going to be receiving 8,050 doses to vaccinate Erie County residents. Hopefully tomorrow we'll receive that shipment. And that is, it consists of 2,200 Moderna doses and 5,800 and 8,000, 5,850 Pfizer doses. What we've found out from the New York State Health Department in that all of Erie County, all the providers and pharmacies, they're going to be receiving 27,400 doses from the New York State Department of Health. And that doesn't even include the doses that are being received from the federal government at the FQHCs, also at pharmacies, at the FEMA Delavan Grider site. So we're really going to be receiving a lot of vaccine to our community this coming week. And then also, fortunately, as we're receiving more vaccine, the eligibility is opening up. So more Erie County residents are going to be eligible to get vaccine. So starting today, everybody who is 30 years of age and older is eligible for a COVID-19 vaccine. And then starting a week from today, on April 6th, everybody who is 16 years and older is eligible for a COVID-19 vaccine. So even though we are getting more vaccine in our community, we know that we still don't have enough to meet the demand. So just because we have eligibility, it doesn't mean that we have availability. So we will eventually get to you if you want a vaccine. It may not be as soon as you had hoped. Looking at our progress so far, we're making great progress in getting everybody vaccinated in Erie County. So far, among Erie County residents, 31% have received their first dose, and so that's 289,339 people. And then considering only adults 16 and up are eligible to get vaccinated, that's actually 39% of all adults have received at least one dose of vaccine. And then for the second vaccine, we're making headway. So far, 17% of all Erie County residents, so that's 159,120, have received their second dose of vaccine. And again, that's considering only adults can get vaccinated right now. It's 22% of all adults are fully vaccinated, have received the 2 doses. So we are really excited. And Erie County Health Department, we have contributed to that. So for the health department, we have provided 42,791 first doses and 28,585 second doses of vaccine. So we are trying as hard as we can to get those numbers up. So this slide is looking at the proportion of the population by zip code and municipality that has been vaccinated with at least one dose of the COVID-19 vaccine. So this is coded with the yellow areas are rural, the green rows are suburban, and then the blue rows are urban. And so this is a descending order from the lowest vaccine penetration to the highest vaccine penetration. So you can see that, unfortunately, many of our urban areas and then also many of our rural areas are under-vaccinated. We're not where we want to be. And that's why we're going to have these pop-up clinics in the coming weeks. So we're partnering with our community partners to identify locations where the community feels comfortable going and vaccinated, that's convenient for people. And so we're hoping we're going to bring all those numbers up, especially in those areas where we're seeing low penetration rates. So just shifting over to New York Forward, they were, as well as in addition to vaccine eligibility opening up, we're also having venues opening up too. So starting this Friday, April 2nd, with testing, catered events can increase to either 75% capacity full or up to 150 people indoors or 500 people outdoors. So whichever is less, either the 75% capacity or the number of people. So hosting venues that are planning on having an event with either 100 people indoors or more or 200 people outdoors, they should contact the Erie County Health Department. We can go over your safety plan and make sure that you have a safe and fun event. And then for businesses, if you have questions about what's opening up, what you're allowed to do, please check with the New York Forward for updates in your industry. So it's springtime, and it's a time to celebrate with holidays. I know we celebrated our Seder with Passover over the weekend, and I know this coming weekend is Easter and Good Friday. And so I know that families like to get together, and people like to come together to celebrate. It's human nature. But I just want to alert people, we are seeing high numbers in Erie County, and throughout the country we are seeing high numbers. So we still have to be smart, even though people have been vaccinated, to protect ourselves against transmission when we're getting together with other people. So just some rules of thumb. I mean, it's the same old story, but we still have to continue practicing these safe measures of limiting our gathering size. Remember, outdoor activities are safer than indoor activities, so try to do as much as you can outdoor now that the weather's getting nicer. Even if you've been vaccinated, try to make sure that everybody wears a mask. Just try to be as safe as possible. If you're having a meal, try to use disposable plates and utensils. And then if you're sick, please stay at home. If you could have COVID-19, you could have something else that's going to make other people sick. So please stay at home if you have any type of symptoms whatsoever. And then also, we know that a lot of people like to travel for spring break, get to some little bit nicer warm weather. We know that outside of New York State, especially in the South, there are very high numbers of COVID-19. So please, I want to encourage people to please strongly consider postponing your travel to a later date when our COVID numbers are lower. We still want to encourage people to know their status of COVID-19 in Erie County. There is plenty of testing around Erie County. The health department, we are still offering free COVID-19 testing. You still need an appointment by calling 858-2929. But all Erie County residents that want to know their status can have access to either a PCR test, which is a molecular diagnostic test, and the results are available between 1 to 3 business days, or we're also offering rapid test results, and those are available on site usually within a half hour. So it's really important to know your status. Testing is still an important strategy to reduce transmission in our community. We still have to test to know your status. And then the Erie County Health Department is still continuing to do our work outside of COVID-19. We're still seeing overdose deaths, as we talked about. We're still seeing sexually transmitted infections. We're still seeing people fall ill from tobacco-related illnesses. So we are going to be at the Broadway Market this Thursday and Friday between 9 a.m. and 1 p.m., providing good health education around sexual health care. We're going to be giving out condoms. We're going to give out masks. We're going to be training and giving out free Narcan kits. We're going to be educating people around smoking cessation and giving out materials around smoking cessation. So we really want people to come as you're on your way to get your buttered lamb. You can pick up some Narcan and some great health information when you're at the Broadway Market. So also want to wish a happy Doctor's Day to Dr. Nylander and my physician colleagues. I know all physicians have been working so hard for the past year, and I just want to thank them and commend them for so many sacrifices and working so hard to keep our community safe and healthy. So thank you. And now I'm going to turn it over to our county executive to entertain questions from the media. So thank you.
Thank you, Dr. Burstein. Thank you, Dr. Nylander, for joining us today with those important words, important advice. And it's coming from the doctor who practices in that area. So if you are considering whether you should get vaccinated, you're a pregnant woman, follow the doctor's advice. Yes, get vaccinated. If you are a loved one of someone who's going through a pregnancy, get vaccinated so you can then see that beautiful baby. And if you don't even know anybody who's pregnant, still get vaccinated, because it'll save your life and potentially the lives of many others that you come in contact with. So let me just make certain I hit my sheet here somewhere. You seem to have lost it. We will, that's all right. I think I know our parties by now. We'll open up the phone lines, and we will start with WGRZ TV. I believe Kelly Dudzig is on.
Hello. Are there any plans to do any big vaccination clinics now that we know the convention center isn't happening? And I know a lot of people are going on today trying to find appointments, and they're still having to go to Rochester or Syracuse.
There are so many appointments in our community that are not available on the state site. I would just remind everybody, the state site is listing state locations. It does not list every appointment that's available, including those that are at pharmacies. As Dr. Burstein noted, we're going to be announcing next week and opening up our new phone line as well as our online portal so that those who don't really use the internet well will be able to call for doses that are available. Yesterday, I believe we did more than 2,600 total doses between the two clinic locations that Erie County had. Those are first and second doses. So we've done a lot of doses over the last couple weeks. They may not all be at one location. It could be at multiple locations like we had yesterday. I know we have a couple of big locations going on today. So while we might not have one location that's doing 3,000 or 4,000 doses, we can have a couple of locations that are doing nearly 3,000 doses. And there are so many other locations, pharmacies and doctors' offices that are getting doses. You should contact all that you are in your sort of your healthcare world. I've had people say, hey, I was surprised I showed up at this one pharmacy and they were able to get a dose from me the next day. So it's not always on the Am I Eligible state list. There are other locations that are receiving it that are then scheduling doses through their normal appointment scheduling routine. So there are 27,000 plus doses that will be coming into Erie County for all providers next week. Erie County will be receiving more than 8,000 of those. I also know that pharmacies will be receiving more than 8,000 of those doses. And there are doctors' offices that will be receiving hundreds that had not gotten zero or had received zero before. So it's important that you check with all potential parties that you deal with your health care, because there's a chance that whether it's your pharmacy or doctor, they may be getting doses and will be able to help you. Channel 4, George Rickert.
Hi, Mark. Can you put into more perspective how significant 27,000 vaccines this week is? Is that about the highest number that we've had so far, or even the 8,000? I realize 8,000 of the 27,000 are Erie County. Is that the highest number that Erie County has had?
To my knowledge, those are the highest for both. 28,000 approximate. Well, it's actually going to be more than 28,000 because what we had was 27,400, which included all sites except for the Delavan Grider Community Center. And we know the Delavan Grider Community Center is doing at least 800 a day. So more than 28,000, and basically around 30,000 doses will be distributed to and available for first dose administration by Erie County providers. That includes pharmacies, doctors' offices, federally qualified health centers, hospitals, and the Erie County Department of Health. And the 8,000, I believe, is the largest amount that Erie County has had. We had 7,000 previously. We've seen 4,000 to 5,000. 8,000 is the highest the Erie County Department of Health has, and we have a dedicated plan to get those doses out. Once again, we do not schedule appointments or make appointments available to be scheduled until we have the doses in hand. So we've received notice of what we're expecting to get. We haven't gotten the doses yet. We expect to get those in the next 24 to 48 hours, and at that time we will open up additional clinics to provide to the general public.
Do you think it might be the new norm?
I certainly hope so, George. We've been told more doses would be coming. New York State increased to 30 age and higher, the qualifications. The president has said he wants all age range available very soon, and that hopefully by May 1st, all individuals who want a dose will have been able to get at least a first dose. So I'm hoping this is the new norm. We've been told it was coming, the increased number of doses, and this upcoming week is definitely an increased number of doses. And we've actually retained more nurses and more parties to help us administer those at our clinics. So you're going to be seeing more staff from Erie County Department of Health administering these vaccine doses at our upcoming clinics. Is anyone on from Spectrum News? Dominic Lavello? I think.
Hey, Mark. Yeah, thanks for taking the question. So this one's more for Dr. Burstein. With eligibility going up, as well as the amount of people who are actually getting sick in our county, is there any reminder you'd have for people who might either be recently recovering from COVID or someone who just feels sick nearing a time of getting a vaccine, should they still go to their appointment, or should they push it off for any reason?
Right. So one of the contraindications to getting a COVID-19 vaccine is really more to protect the vaccinators than the individual, is somebody who is in active isolation because they've been diagnosed with COVID-19 in the past 10 days, or somebody who is in quarantine because they're a close contact, so they're at very high risk of becoming infected with COVID-19 in the next 10 days. So if you're in isolation or quarantine because of COVID-19, please reschedule your appointment. We don't want you to come in and infect our vaccinators and to infect everybody else in the community. And if you're sick at all with anything, it could be COVID-19. So again, we really encourage you to reschedule that appointment. Don't make other people sick around you because you're sick. For people who have had COVID-19 in the past, if it's been more than 10 days out and you're out of isolation, or if you were a close contact and you were negative, you're out of quarantine, it is very safe to get the COVID-19 vaccine. That is not a contraindication. The only time that we would ask you to hold off on getting a COVID-19 vaccine is really under advisement from your healthcare provider. If you were sick with COVID-19 and you received certain type of medication, like some antibody medication for COVID-19, then you want to wait for 90 days. But that's something you would discuss with your healthcare provider. But please, people who are in isolation or quarantine or who are sick for any reason, please reschedule your clinic appointment. Thank you.
Thank you. Is anybody on from Channel 7, WKBW?
Hi, County Executive. It's Ashley Rowe here. Quick question regarding Buffalo Dingus Day. Organizers say they are planning to have a Dingus Day parade. Are you concerned about that event?
We've advised them they cannot have the traditional parade. They can only have a car parade in which individuals are in the vehicle, not standing on flatbeds, no people along the side of the road. The only individuals who can stand theoretically would be those that live in the home. It would be, we've advised them, I know Dr. Burstein is shaking her head, that the traditional parade cannot be held. My understanding is they will not receive a permit from the city of Buffalo to perform the traditional parade. If they have a car parade, like you've seen often during COVID, where people drive along and honk their horns and they wave from their windows, often for birthdays and occasions, that is okay. What we can't have is the parade where there's thousands of participants in the parade and thousands along the side of the road who are just drinking, having a good time. If that happens, it's going to have to get shut down. I know, having talked to the mayor in the past, he's concerned about this. So for the folks who are going to be celebrating Dingus Day, and as a proud son of Polonia, I know you want to go out there and celebrate Dingus Day, but you can't do it in such a manner where you're going to put yourself and others at risk. So the traditional parade cannot be held. If they do a car parade, driving around neighborhoods, however it's done, that's okay. But there will not be a parade in which people are partying alongside the road. There will not be a parade in which people are on the back of a flatbed and you've got 20 people on the back of a flatbed drinking and shooting squirt guns. It just won't happen. And if it does, it's going to get shut down. So I hope the folks associated with the Dingus Day Parade understand that we are serious. Your car parade is okay. Your traditional parade is not going to be okay. And we have no interest in shutting anything down, but if we have to, we will. And we'll work with law enforcement to do so if that's the case. It's not the situation we want, but cases are going up, hospitalizations are going up, and truthfully, over the last week to 10 days, we've seen an increase in deaths. So we just want to cut back on the number of deaths, the number of hospitalizations. This is not a hoax. It is not a joke. And I hope that people take it seriously on Dingus Day, just like I hope they take it seriously on Easter, and there's not these gigantic Easter gatherings where individuals are putting their family members at risk. We've seen it with prior celebrations, whether it's non-religious or religious celebrations. So I'm hoping that people take it seriously. WBFO, is anyone on from WBFO? Hearing none. Brendan from WBEN?
Hey, Mark, even though Erie County is receiving a larger supply of vaccine coming up, the state obviously opened up eligibility to a massive segment of the population. Were you at all surprised by the announcement from the state? And do you think it makes sense to open it up that drastically? Does the supply, even though it's larger, does it equate to opening it up to that much of the segment of the population?
Well, I will say that one of the things that we've seen, and I'll go back on my chart here if I can find it, is the increase by age range. And you will note that the governor opened up for 30 and above, and while we haven't hit children yet, if you look at the age range of 23 and above, 23 to 29 and 30 to 39 are tied pretty much with the highest percentages, and the 40 to 49. So I think it was important because there are people who are at risk in these age ranges, and the same thing goes when you look at cases confirmed by age groups. The percentages for the 30 to 39 is the second highest, and it's very high as a percentage of our 100,000 per population. So I'm not surprised the governor did it. We knew that there would be an increase coming up in the eligibility. We weren't necessarily certain who was going to be included in that, and it was important to send the message out that just because you're younger, you can get sick, and there are people who are getting sick and getting hospitalized. They may not die, but there are younger people who are hospitalized in hospitals right now, and we want people to understand that it is still a risk, and if you can get a vaccine appointment, get it, schedule it, get the vaccine in your arm. I had my second dose this past weekend and really had no reactions. Actually, my side effects for the second dose were better, so to speak, than my first dose. First dose, I had a sore arm for about 24 hours, pretty sore, but nothing beyond that. Second dose, I really had nothing. So don't be scared. Get the vaccine, regardless of your age, because you are susceptible of catching COVID no matter your age. It is non-discriminatory. It doesn't care how old you are. Doesn't care your race. Doesn't care your ethnicity, doesn't care about the size of your bank account. You can catch it. And we want people to know that more doses are coming into the community and more people are eligible. Not everyone's going to be able to get a vaccine appointment exactly where they want, but we are doing a better job of getting vaccines in and into the arms of our constituents. So hopefully, now that there's more eligibility, that'll reduce once again the rate of infection, because it has generally been younger people who are becoming more infected with it in the last few weeks. Sandra Tan, Buffalo News.
Hi, Mark. Thank you. I know you weren't able to attend the press conference earlier today at Bill Stadium. Was wondering if you had any reaction or any thoughts about the new naming rights, Mark being named, having the naming rights to the stadium. And I'm also curious to know where things stand as far as negotiations over the lease with the Pagulas. We haven't heard anything about that for some time, but obviously that lease is coming up upon expiration. And this is just tangentially related, but you've talked about outdoor vaccination sites, maybe later in April, and I didn't know if outdoor sports stadiums, possibly Bill stadiums, is being considered.
Well, any large site that has a ample room, which would also be parking lots, is being considered, but we're not there yet. We're not in a position to be opening up a super mass vaccination site just because of the temperature. For those that have had mass vaccination sites outside, they've had to shut them down at times in the south, and even some of them that have indoor aspects of it but do have outdoor entry points and registration areas in the Northeast have had to be shut down because of the weather in recent days. So we are looking at all sites that have a large footprint so that you can get many cars in and out. But that's not going to happen until late April, early May, just because of weather concerns. With regards to negotiations, as I've said in the past, we always have conversations between the county and the Bills organization. We never go into the substance of what those conversations are. When there are substantive negotiations in which we're actually sitting down and talking on a daily basis, We will once again let the public know that there are substantive negotiations, but we don't go into the particulars associated with the negotiations. And generally, media and the public will learn about the status of where it is when we announce it. Whatever deal's entered into. And with regards to the stadium naming rights, I had been advised for some time about the naming rights deal. We've had some conversations. The Bills do have the right to name the site through the remainder of the lease, as long as it is not offensive, does not bring shame, so to speak, to the community, does not advocate underage drinking. I've had conversations with the Highmark representatives, the Blue Cross Blue Shield, soon to be Highmark representatives. We've talked about a number of issues. They look at the naming rights as a commitment to this community. Blue Cross Blue Shield, soon to be Highmark, is also the health insurer for Erie County residents, Erie County employees. So one of my concerns also was marketing and the costs associated with it. I was certainly hopeful that the ratepayers' fees would not be going towards paying for the name of a stadium that's owned by the people of Erie County, especially Erie County employees' fees. It would be really silly for the Erie County employees to be paying a fee to an entity that then uses part of that fee to pay for the name on our own stadium. So I've had multiple conversations with the Bills and Highmark about that, including in recent hours. They have the right to name it as long as it doesn't bring any kind of shame to the community. As we've seen with regards to the New Era problems and some of the things that have resulted, I've had my personal favorite, which would have been Erie County Veterans Stadium, but the team does have the right to name the stadium as it is through the remainder of this lease. What happens afterwards will all be subject to the future negotiations that the county has with the Buffalo Bills and New York State.
Okay, just because we're hearing that this might be a 10-year deal, so you're saying it couldn't be a 10-year deal?
It could not be a 10-year deal because it will expire effective as of 2023. I forget the exact date in 2023. It might be July. But if they have a 10-year deal, I don't know how they could enter into a 10-year deal because the naming rights expire and effective at that time, unless we grant them additional naming rights, they revert back to Buffalo, or excuse me, they revert back to Erie County. And we could name the stadium, Erie County could name the stadium whatever we wanted, including, even if we wanted to, selling naming rights, though I don't think that would be appropriate. As I said, my preference would be to call it Erie County Veterans Stadium. Back to the top, or anybody else on that I haven't called on?
Yes, hello.
Well, was that Dave McKinley?
Hi, Mark.
I did. Well, we'll start at the top again because I think I started with Channel 2, WGRZ. So Channel 2, WGRZ. Mr. McKinley, go ahead.
Yeah, hi, Mark. I think you got to admit that's a catchy name for a stadium. Hi, Mark. Yeah. Okay, so
it's not named after me.
You were given emergency spending powers by the legislature outside of those granted by the state executive laws to move swiftly at the onset of the pandemic, so that you could move quick and fight it and do what you needed. With the pandemic certainly not over, but a lot of the uncertainty about what you need to do to keep fighting it no longer a mystery. You know, there are some legislators concerned that with more money coming in from the federal government, you more or less remain in sole control of it, or at least any single expenditure more than $250,000. There was a move in the legislature to roll back your authority. It failed along party lines for now. My question is, do you agree, though, that we need more of a representative government at this point, and that the legislature does need to be involved more with spending of the funds that are coming in, millions of them, and how they are spent should not rest with a single individual such as yourself?
Well, I totally disagree with the premise of your question because the legislature has ability to approve anything over $250,000 directly attributable to COVID.
Right.
Previously, I had unlimited carte blanche power. I will not deny that. And that was agreed upon to be reduced. Basically, the power that I always have, which is to approve a certain number of contracts without going to the legislature, was given 100% with regards to any dollar value during COVID-19, was reduced to $250,000 per contract, per item. And that is significant because the vast majority of contracts that go over, especially with regards to COVID-19, even this year, has been $250,000 or more. We're talking about things that need to be done instantaneously like that. The one thing I'm very disappointed about, and I think after watching the last 4 years with President Trump, in which he will just lie about anything, is the Republicans are making it sound like I have complete control over the budget when it comes to COVID. I do not. The legislature has the ability to approve any contract over $250,000. And the vast majority of contracts that go over to the legislature are very large contracts. So they're getting it already. It's just a small set of things. So I want the public to understand that there's a very vocal minority in the legislature who like to cry about a lot of stuff. But in the last legislative session, the legislators, including majority members, noted they have the power. They have the power of the purse to approve $250,000 or more. And almost everything with regards to the New American Rescue Plan is going to go over to the legislature for their approval because it's going to be more than $250,000 or more. So I disagree with your argument that I have complete control on this, David, because it's not true, and I certainly hope you wouldn't report it that way, because then that would be reporting a falsehood. I hope it's as simple as this. Some legislators may cry that they don't have complete power and control over it. Well, I don't have complete power and control over it. I make a suggestion, I propose and send over a resolution on spending that goes over to the legislature for their approval. So it's not like we don't have checks and balances. The checks and balances exist. The check of the legislature being able to approve my spending proposal, and it's also a check in the charter that says the legislature cannot start a spending proposal on its own. It has to come from the county executive. So there are checks and balances, significant checks and balances, and it would be impossible for me to try to spend $178 million in less than $250,000 increments. It just couldn't be done. When we buy PPE, some pallets of PPE themselves will cost $250,000 or more because of what we're purchasing. So I think it's important for the public to understand that this is, as we often call in the legal profession, a red herring. They're throwing something out there to make it sound like Mark Poloncarz has all this power, and we're going to strip him of his power. I don't have all that power. And that is something that was agreed upon not only by my office in consultation and discussions with the legislature, but individualized discussions I had with the chairwoman of the legislature. And $250,000 was agreed upon because below that gives the Department of Health, Department of Homeland Security, Emergency Services, Department of Purchasing, the availability act instantaneously instead of having to send something over to the legislature and hoping it gets acted upon within 2 weeks.
But you got like Mahailu talking about, expenditures less than like pork chops. I didn't even know you cared for them, that you liked them. But
next question to Channel 4. I mean, that is complete bull, and you should be embarrassed, David. Channel 4, George Rickard.
Hi, Mark. Back to the stadium naming rights. They did not disclose a specific amount of money, but as you pointed out, the concerns that customers of Blue Cross Blue Shield may have for paying for this, are we safe to assume that even for 1 year of naming rights, we're talking in the millions of dollars or maybe tens of millions for a multi-year? Is that a good ballpark figure, or do you know more specific of what they actually paid?
George, I cannot answer that question. I do not know. I'm not privy to the conversations, nor have seen the contract. Erie County, let me backtrack. The Buffalo Bills are not required to provide that contract to either New York State or Erie County. So for me to answer that question would be speculating, and I cannot speculate. I would suggest you contact those that are consultants or those that are much more knowledgeable about existing naming rights deals going around across the United States, and they could probably give you a ballpark. But I cannot give you an answer. That would be pure speculation, and it would be inappropriate for me to offer something that I don't know about.
Okay.
WKBW, any more questions?
Yeah, just one more question for you. President, and this might be a question actually for Dr. Burstein. President Biden is concerned about the growing surge of variants, and we know that on a national level, we really don't have a robust testing capability for these variants. How soon can we expect to see a greater sophistication of the variant testing? Has the CDC indicated that, or has the state indicated anything like that?
Well, I'll turn this over to Dr. Burstein, but I can note that The University of Buffalo Medical School Genomics Institute is actually testing right now samples that were provided in the month of February and March to them, so we'll have a better idea, but I'll turn it over to the doctor to talk more.
Thank you. So, the president is correct. I mean, we need to have a more robust genetic sequencing surveillance system to detect variants in our community. And we could use those data even to look at what type of changes might needed to be made in the vaccines or the medication that we use to treat COVID-19. However, we don't have that right now. What we do have is, as the county executive mentioned, UB's Genomics Center is doing genetic sequencing on specimens that the Erie County Health Department provides and also that Coletta Health provides. And so they are doing testing this week and next week, and we're going to continue to send them specimens. So again, we want people to get tested. So one of the things we're going to do if you test positive is send your specimens to UB to get that genetic sequencing and provide us with great important information about the epidemiology of COVID-19 in our community. I know that Wadsworth, New York State Public Health Lab, is doing a genetic sequencing looking for variant strains throughout New York State, and hopefully there will be funding available for other players in academic centers and in public health laboratories to do more genomic sequencing, because we do need these data. It is vital, you are right, and we're behind the ball for that. I know Europe is much more advanced in this than we are, and we really need to catch up. So thanks.
Okay, before I take the final couple questions, I just got from our Department of Health epidemiological staff the latest numbers and cases for Monday, March 29th. And the Department of Health epidemiological team can confirm there were 539 cases confirmed on Monday, March 29th, which is the highest daily total since late January. The total confirmed cases in the past 7 days is now 2,931. The total new cases in the past 7 days per 100,000 persons equals 318.9. Total confirmed cases through March 29th since the beginning of the pandemic is 73,256. And per the New York State Forward site, the daily positivity rate for Erie County was 8.0 for yesterday. Folks, this is serious. This is not going away, and we need to be better. Did anybody come on from WBFO? If not, WBEN? Okay,
I'm
Brandon.
actually all set, Mark.
Okay, thanks, Brandon. Sandra, do you have any more questions from Buffalo News?
Yes. It seems ironic that we're seeing this, finally seeing more doses, first doses of the vaccine coming to Erie County, and at the same time, Erie County is seeing this upward trajectory in positive cases. And I guess this question could be for you or Dr. Burstein. What factor or combination of factors do you think is contributing to this this surge? I know this is something that you guys have touched on before, but I think it's worth repeating because we've talked about the variants, we've talked about people getting lax. So just interested in your thoughts on what's contributing to these higher numbers now.
Well, I'll also turn over to Dr. Burstein, but we are seeing the variants. We are seeing increases in travel, not only individuals from our region elsewhere, but individuals coming here. We are seeing lax wearing of masks, especially in group settings, and I'm not talking about just in somebody's house to watch a sporting event. We know that there have been increases in cases in work sites, work locations, whether it's indoors or outdoors like construction sites. So we are seeing it everywhere. We've noted that there appears to be some in-class transmission in the last couple of weeks in area schools. So it's everywhere. It hasn't gone anywhere, and the problem with the variants, they're more transmissible, so they're more easily caught. I don't know if there's anything else that I missed. Doctor's going to come up now. And congratulations, happy National Doctors Day. I don't think I get to celebrate it as a Juris Doctor.
Thank you. So, as Sandy, you brought up a great point. There seems to be a dissonance, right? As we're seeing a growing number of cases in Erie County, and we know that there's more transmission, and we know that the reasons are the variant strains, which is changing the epidemiology of the virus. We're seeing, more younger people who are infected now. We're seeing higher rates of transmission, and and seeing more people travel. Bringing new infection in, and people putting down their guard with preventive measures. And at the same time, as the numbers are going up, instead of hunkering down on our preventive measures, like everything's opening up, and so we're really behaving the exact opposite as we should be behaving. So just because there are more venues that are open and have a larger capacity to hold people, doesn't mean that that's really the best choice for us. I mean, as the county executive just showed, we have a lot of virus in our community. Our numbers are increasing every week. I mean, something has changed. The epidemiology of the virus has changed. We're seeing more transmission in the community. And instead of thinking, okay, we're good now, the virus, everybody's getting vaccinated and the virus is gone, so we can let down our guard, that's not true. And so we have to listen to the numbers and still, keep up our preventive behaviors, keep up the masking, do as much as we can socially outdoors instead of indoors. And just because you can do something doesn't mean you should do something. So we still have to keep up our preventive behaviors because our numbers are growing up. And this is a national trend, and we just have to be careful. Thanks.
Thanks.
Thank you all. This will conclude our press briefing for March 30th.
Hey, Mark. I'm sorry, I didn't mean to interrupt you. This is Dan from Business First. Do you mind if I throw one last one at you?
Is it related to COVID, Dan?
It's about the ErieNet program that you were speaking about.
We'll talk offline. I also have to run.
Okay.
Dan Meyer will set it up. I want to thank everyone for participating. Dr. Nylander, thank you for being here today with your important words to the general public. Get vaccinated. And I just want to close in memory of, once again, of my good friend Robert Farmer, Bob Farmer, who passed away from COVID complications in the last week. There are nearly 1,800 Erie County residents who passed from COVID-19 since the beginning of the pandemic in March of 2020. Every one of them has a story. Every one of them is more than a number. And I just want to remind everybody we need to do our best. And to Bob's loved ones, we will know he will be missed. So I'll close with a moment of silence in honor of Bob Farmer and to all those who've unfortunately lost loved ones during the COVID-19 pandemic. Thank you. Thank you, Kendra Schmidt, as always. And until I talk to you next time, be safe and well all. Take care.